With all of these changes and the programs, physicians need to adapt. But they need to do so quickly. Because as Will Rogers once said, even if you're on the right track, you can get run over if you're not going fast enough. And the pace in which things are changing are dizzying. Each one of those new developments means that we as physicians, and I say we because what Dr. Combs didn't say in the very generous introduction is that I am a general internist and I practice and have always practiced medicine and I still see patients. Although today is my clinic day and I'm giving it up for you. So each one of us needs to be able to better manage not only the patient sitting in front of us, but our panel of patients as a population. Not just what is happening face-to-face in that individual encounter. We have to become better able to coordinate care across multiple venues, and we not only have to be better at improving health outcomes, but in demonstrating that. In other words, being accountable to our patients, to the public, to policymakers, and payers. All of these challenges can only be met through the adoption and use of health information technology. As a profession, we are rapidly reaching the point in which the complexities of medical care mean that we will not be able to practice high-quality medicine without an EHR. Young physicians coming out of training will expect it, patients will insist on it, and physicians who don't have those capacities and tools will find it increasingly more and more difficult to meet the demands of the payers, both private and public. And while all of this may be very sobering for those who have not yet embraced the technology, there is good news. And that good news is that there has never been a better time to get on board than right now. It's been many years since policy experts such as Dr. Blumenthal have been calling for the use of increasing health information technology, but there have been significant barriers, and we all know them. You all articulated them. Privacy concerns, a lack of standards, a lack of systems being able to talk to each other, really a concern about the return on investment, a concern that we as physicians will do the investing, but the return on that investment will accrue to the payers. So over the past few years, there has been significant development, and thanks to Dr. Blumenthal and his predecessors at the ONC and others, current EHR technology has the capacities, has better tools to succeed in this, and now is the time. It's not just about replacing paper files with electronic files. It's about improved workflow. It's about the embedded decision tools right within the EHR. And it's about being able to successfully manage your panel of patients and not just that patient in front of you one-off. And soon we will have that electronic exchange of information. But even if that is delayed, even if we are being rosy about when we can bring on meaningful health information exchange, the benefits for the EHR technology for you and your panel of patients means it is worthwhile now.